Assalamualaikum warahmatullahi wabarakatuh. First of all, let's just thank to Almighty Allah Subhanahu wa Ta'ala. Because of His blessing, we are able to come here to join in the English meeting. Secondly, salawat and salam also delivered to our Prophet Muhammad Sallallahu Alaihi Wasallam, who has guided you from the darkness into brightness. My friends, the presentation today is about presentation of truth. Now I will read one by one the agenda they are. The first session is opening, the second session is introduction, the third session is presentation time. Well, my friends, before show our presentation, let me introduce myself. My name is Nadia Sasabila as moderator, Christina Angel as first presenter, Serika as the second presenter, Sevi as the third presenter, and me for the presenter, and Penny Febrian is 5 presenter. My friends, and now let's open our meeting by saying Basmalah. Bismillahirrahmanirrahim. Thank you. The next agenda is presentation session. For the first turn will be given by the first presenter. Please welcome to Christina Angel.
Thank you. Before knowing any deeper, we must know the understanding of stroke first. Stroke is a condition that occurs when the blood supply to the brain is interrupted or reduced due to a blockage or ischemic stroke, or rupture of a blood vessel or hemorrhagic stroke. Without blood, the brain will not get oxygen and nutrients, so cells in some areas of the brain will die. This condition causes the part of the body that are controlled by the damaged brain area to not function properly. Stroke is an emergency condition that needs to be treated as soon as possible because brain cell can die in just minutes. From an appropriate treatment can minimize the level of brain damage and prevent possible complications.
Cause of the stroke. Based on the cause, there are two types of stroke, namely, the first is ischemic stroke. An ischemic stroke occurs when the arteries that carry blood and oxygen to brain become narrowed, causing a marked reduction in blood flow to brain. This condition is also known as ischemia. Ischemic stroke can be further divided into two types: thrombotic stroke and embolic stroke. The second, hemorrhagic stroke. A hemorrhagic stroke occurs when a blood vessel in the brain bursts, causing bleeding. Bleeding in the brain can be triggered by several conditions that affect the blood vessels. The condition include uncontrolled hypertension, weakening of blood vessel walls, and treatment with blood thinners. Hemorrhagic stroke are of two types, namely intracerebral and subarachnoid hemorrhages. I return into the moderator.
Okay, thank you Nadia. Prevention of stroke. 1. Lowering high blood pressure. Keep blood pressure normal. The trick is to eat lots of fruit and vegetables. 2. Lose weight. It is advisable to lose weight so that the risk of stroke is reduced. 3. Exercise regularly. Exercise has an important role to play in losing weight and maintain stable blood pressure. 4. Treat diabetes. High blood sugar level in the body can cause damage and blockade in the blood pressure. If it damages the blood vessel of the brain, the risk of having a stroke will be higher. 5. Do not smoke. Smoking can insert the risk of stroke. 6. Keep the diet. Eating too much food can insert the amount of cholesterol in the body, the blood risk of developing hypertension that can run. 7. Avoid using drug. Certain type of drug can cause narrowing of the artery and reduce blood flow. And last, avoid alcohol consumption, liquor in high in calorie. Okay, back to the moderator.
Risk factors which include hypertension, diabetes, high cholesterol, obesity, heart disease such as heart failure, congenital heart disease, heart infection or arrhythmias, and sleep apnea. Have had a previous TI for heart attack.
Some of the other symptoms and signs of stroke include nose and vomiting, severe headache that comes suddenly, accompanied by neck stiffness and dizziness or vertigo, loss of consciousness, difficulty swallowing or dysphagia resulting in choking, disorder or balance and coordination, sudden loss vision or double vision.